Hello, this is Dr. Emma Nichols, and this is the information on the latest U.S. FDA approvals for the week of January 29th through February 2nd, 2024. So first up this week, we have the FDA approving the Evoque, EVOQUE, Tricuspid Valve Replacement System for the treatment of tricuspid regurgitation, TR. This marks the first approval in the United States for a transcatheter tricuspid device. This approval comes shortly after early favorable results were presented from the TRISCEND II trial, which showed that in patients with severe TR, the Evoque system significantly improved TR grade and led to meaningful improvements in patients' functional status and symptoms. TR is a condition where the valve between the two right heart chambers does not close properly, leading to blood flowing backward into the heart. The device has already received CE mark approval in Europe. The approval of the Evoque system was granted to Edwards Lifesciences. Also last week, the FDA has accepted for priority review the Biologics License Application, BLA, for afamitresgene autoleucel, also called Afami-Cel. This is an investigational engineered T-cell therapy for the treatment of patients with advanced synovial sarcoma. This application is based on data from cohort 1 of the phase 2 Spearhead 1 trial. Previous results from the trial indicated an overall response rate of approximately 39% in heavily pretreated synovial sarcoma patients with a median duration of response around 12 months. The median overall survival in cohort 1 was approximately 17 months, with a 70% chance of survival at 2 years post-treatment for those who respond to Afami-Cel. Annually, there are approximately 13,400 new cases of soft tissue sarcoma in the United States, with a 5-year survival rate of 20% for those with metastatic synovial sarcoma. Treatment options are limited for advanced disease, which commonly recurs. Afami-Cel is manufactured by Adaptimmune Therapeutics. The PDUFA target action date for the application is August 4th, 2024. Also last week, the FDA has approved Boston Scientific Corporation's FARAPULSE pulsed field ablation PFA system for the isolation of pulmonary veins in the treatment of drug-refractory, recurrent symptomatic paroxysmal, i.e. intermittent, atrial fibrillation. According to a manufacturer press release, the system is a unique new alternative to standard of care thermal ablation. Unlike traditional ablation procedures, which use extreme temperatures to destroy targeted areas of the heart, the FARAPULSE PFA system employs tissue-selective, non-thermal electric fields. This method allows for the ablation of heart tissue while avoiding damage to surrounding structures. The approval was based on findings from the ADVENT study, which compared the efficacy and safety of the PFA system against standard of care ablation. The study indicated that the FARAPULSE PFA system had statistically shorter ablation times. Additionally, real-world data from over 17,000 patients in the Manifest 17K registry confirmed the system's continued real-world safety, with no reports of permanent phrenic nerve palsy, pulmonary vein stenosis, or esophageal injury. Boston Scientific plans to immediately launch the system in the U.S. And now a word from the supporter of this podcast, Nascent Medical. Access our medical writing assistants at nascentmc.com. Our native English-speaking MD and PhD level medical writers are dedicated to delivering top-quality content anytime you need it. Whether you require rapid turnaround needs assessments, medical news pieces, manuscripts, slide decks, or at-board summaries, we can help. Visit nascentmc.com. We'll get back to you immediately within business hours Eastern Standard Time. That's nascentmc.com. Also last week, the FDA has approved a manufacturing process change for Axi-cel, Yescarta. The change is expected to reduce the median turnaround time for its delivery in the US from 16 days to 14 days. Axi-cel is a CD19-directed CAR T-cell therapy used for treating relapsed or refractory large B-cell lymphoma. CAR T-cell therapies, such as Axi-cel, are highly personalized treatments created from a patient's own T-cells. Cells are collected, modified in a manufacturing facility, and then infused back into the patient. The approval of the reduced manufacturing time can enhance the therapy's delivery efficiency, providing patients with quicker access to treatment. The approval was granted to Kite, which is a subsidiary of Gilead Sciences. Also, last week, the FDA approved the Genius digital diagnostic system with the Genius Cervical AI algorithm by Hologic Inc. for cervical cancer screening. This system is the first and only FDA-cleared digital cytology platform that integrates deep learning artificial intelligence with advanced volumetric imaging technology to aid in the detection of precancerous lesions and cervical cancer cells. Cervical cancer screenings traditionally involve collecting a sample during a Pap test, which is then reviewed under a microscope. The Genius digital diagnostics system modernizes this process by digitizing the glass slides and applying an AI algorithm to highlight cells for cytologist and pathologist review, improving sensitivity and reducing false negatives by 28%. For high-grade squamous intraepithelial and more severe lesions compared to traditional microscopic review. This system also facilitates and enables a remote review of cases. The Genius digital diagnostic system is available in Europe, Australia, and New Zealand, with commercial availability in the US expected in early 2024. The FDA has granted priority review to the Supplemental Biologics License Application, SBLA, of Trastuzumab Deruxtecan, also called Enhertu, for the treatment of unresectable or metastatic HER2-positive solid tumors. If approved, this agent will potentially be the first HER2-directed treatment and antibody-drug conjugate to receive a tumor-agnostic indication. This latest approval follows the breakthrough drug designation received for Trastuzumab Deruxtecan in August 2023. An FDA decision is expected in the second quarter of 2024. The application is based on results from the Destiny Pan-Tumor02 study, which showed meaningful clinical activity with a median progression-free survival of 6.9 months and a median overall survival of 13.4 months. Trastuzumab Deruxtecan is manufactured by AstraZeneca and Daiichi Sankyo. All right, that's it for this week. I do hope you'll check out my free course. It's called ChatGPT-4 for medical writers and editors. And if you're in the pharmaceutical industry at all, you'd probably want to check this out because it's kind of a thing these days, ChatGPT and all that stuff. So it's a very short course, just 20 minutes, but it'll give you a few actionable tips. You'll get some prompts relevant to medical writing and editing. There's some plugins and extensions that will make your job easier. And you can also personalize ChatGPT-4 for the implementation, of AMA style and other guidelines. Anyway, check it out. Go to learnamasstyle.com. That's learnamasstyle.com. All right, thanks so much. I hope you'll be back every Monday morning to catch up with the latest information coming out of the FDA on some of its approvals and things that are relevant to the industry. Thanks so much and have a great week.